Hello and welcome. My name is Dr. Tharwat Gattas, MD, and I'm an assistant professor at LSU HSC Shreveport. Today, I'd like to talk to you about the benefits and side effects of aromatase inhibitors, commonly known as AIs, in the treatment of breast cancer in postmenopausal women. Arimidex, anastrozole, Femara, letrozole, and exemestane, or Aromacin, are all commonly known trade names. Breast cancer is a complex disease, and its growth can be influenced by hormones like estrogen. In hormone receptor-positive breast cancer, the cancer cells have receptors that interact with estrogen, promoting their growth. Aromatase inhibitors work by reducing the production of estrogen in the body, which can help slow down or even stop the growth of cancer cells. Let's talk about the benefits of aromatase inhibitors. The risk of reduction can be as much as 30%. Let's imagine that without any treatment, the risk of breast cancer recurrence is represented by a certain number, let's say 100. Now, if a study shows that using AI reduces the risk of recurrence by 30%, it means that out of those 100 cases, using AI would decrease the number of recurrences by 30%. So, instead of 100 cases, there would be only 70 cases of recurrence. We can improve the long-term outcome by taking aromatase inhibitors. Women who take AIs are more likely to survive than those who do not. AIs can increase the chances that a woman will live a healthier and a longer life after breast cancer therapy. Aromatase inhibitors have also shown promise for breast cancer prevention in certain cases. These medications may be prescribed to women who are at a high risk of breast cancer, like those with a family history. This decision should only be made after a careful evaluation of your individual risk factors and after consulting with your healthcare provider. Now, let's explore the potential side effects of aromatase inhibitors. One common side effect is joint and musculoskeletal pain. Some women may experience mild discomfort, while others may have more severe pain. It's important to communicate any symptoms to your healthcare provider so they can help manage this side effect effectively. Hot flashes are sudden feelings of sweating and warmth that many women who take aromatase inhibitors experience. These can be bothersome but can often be managed through lifestyle modifications and, in some cases, medications prescribed by your doctor. Aromatase inhibitors can sometimes accelerate bone loss, leading to an increased risk of osteoporosis and fractures. Your healthcare provider may recommend bone density tests and prescribe medications to help prevent bone loss. Additionally, although the risk is generally low, there may be a slight increase in the risk of cardiovascular events, such as heart attacks or strokes. However, the absolute risk needs to be balanced against the potential benefits of the treatment. Lastly, aromatase inhibitors may cause vaginal dryness and discomfort during sexual activity. Discussing these symptoms with your healthcare provider is essential to identify strategies to manage them effectively. I want to talk about some ways to mitigate the side effects of aromatase inhibitors, or AIs, in simple terms. These tips can help you manage any discomfort or symptoms you may experience while taking these medications. Let us start with some natural remedies. 1. Joint and musculoskeletal pain. Regular exercise, such as walking or gentle stretching, will help to keep your joints flexible. Applying warm compresses or taking warm baths can provide temporary relief. 2. Hot flashes. Dress in layers so you can remove clothing when you feel hot. Using a fan or keeping your living environment cool can also help. Avoid spicy foods, caffeine, and alcohol as they can trigger hot flashes. 3. Bone loss, osteoporosis. Eat a diet high in calcium and vitamins. Dairy products, leafy vegetables, and fish are all good sources. Engage in weight-bearing exercises like walking or strength training to help strengthen your bones. Medications can be helpful in addition to natural treatments. 1. Joint and musculoskeletal pain. Your doctor may prescribe pain relievers or recommend over-the-counter options like acetaminophen or non-steroidal anti-inflammatory drugs, NSAIDs, to help manage pain. 2. Hot flashes. Medications specifically for hot flashes, like low-dose antidepressants or certain blood pressure medications, like clonidine, or medications for overactive bladder, like oxybutynin. Some vitamins can also help, like vitamin E. 3. Bone loss/osteoporosis. Your doctor may prescribe medications called bisphosphonates to prevent or treat bone loss and improve bone density. Your doctor will order bone scan yearly to ensure your bone health. 4. Increased cardiovascular risk. Make heart-healthy lifestyle choices, such as eating a balanced diet low in saturated fats, engaging in regular physical activity, managing stress, and quitting smoking. Your doctor may prescribe medications to manage specific cardiovascular risk factors like high blood pressure or high cholesterol if necessary. 5. Vaginal dryness. Use water-based lubricants or moisturizers to relieve vaginal dryness during sexual activity. Your doctor may recommend low-dose vaginal estrogen therapy in the form of creams, rings, or tablets to restore moisture. It's important to talk about any side effects with your healthcare provider. They can give you personalized advice and guide you in the best ways to manage these side effects. We can combine natural approaches with medications to ensure that you have the best experience possible while taking aromatase inhibitors. Transforming battles into victories, one patient at a time. Tharwat Gattas, MD.